So now we're going to review non-invasive ventilation in BiLevel mode. So as we were before, we were in CPAP. In order to change the mode, we'll go into modes and we'll change to ST, which is spontaneous timed. That allows for spontaneous breaths and timed breaths. So we'll activate the new mode, and that's just for this machine. But in all machines, you will have the mode either spontaneous timed or BiLevel. It'll have some nomenclature to it like that. And in that mode, when we're in BiLevel, you're going to have several settings. You're going to have an IPAP setting, the inspiratory pressure amount, the EPAP setting, so the expiratory pressure amount. You'll have a respiratory rate that you set. Now, this is a non-invasive ventilator, so it augments spontaneous breathing, but we can set a rate when we're in BiLevel, and that does differentiate it from CPAP, which is continuous positive airway pressure with no non-invasive breaths. So the rate is unique to BiLevel, so we'll set a respiratory rate there, and then obviously you can select FiO2, okay? So we'll enter our parameters in for BiLevel. And as I said before, a standard starting point for BiLevel is about 10/5. So I'll put those in. And I actually have to go into parameters for this machine here. So that's my inspiratory pressure of 10, my expiratory pressure of 5. I'll set a normal respiratory rate or equivalent to whatever the patient is doing. Inspiratory time, normal inspiratory time, depending on how fast your respiratory rate is, but about half a second to 1 second. So 0.8 is a very reasonable inspiratory time. We're going to stay on room air because my subject does not need to breathe oxygen or extra oxygen, but if you wanted to titrate, you would just activate, scroll up, and then change the FiO2. I'm going to put it back down to room air for now. Rise to pressure or rise to IPAP is 0.2 seconds of the 0.8 seconds, so it's about 1/4 of the inspiratory time. So the first 1/4, it should rise to the inspiratory set pressure, which is 10 for this machine, and that's how that works. The faster this goes, the shorter the time, the faster the rise to pressure, so the quicker it will meet the pressure. A comfortable rise to pressure is about 0.2 to 0.3, okay? And as you see below, here's the patient parameters. So this person is breathing 650 to 700 milliliters with a minute ventilation of 13 to 15 liters per minute, which is a bit excessive. And the peak pressure is reading about 11 to 10, and that's what our inspiratory max pressure is set at. Inspiratory time is 17% of the inspiratory phase, and then the mask leak is 45 to 55. So there's a slight mask leak. I'm going to adjust that and see if we can't get less of a leak. So again, I'll take both those top straps together, snug it up, and then both bottom straps at the same time, snug them up and see if we can't fix the leak. Now that we've got our settings in, we now have to go into our alarm limits, just like we did in the CPAP mode. So we'll go into the alarms, and again, our high pressure, that's going to be above our set inspiratory pressure. And so we were set for inspiratory pressure of 10, so 2 or 3 above that's 13, that's perfectly fine. The low pressure, again, that's on the inspiratory pressure. So our max inspiratory pressure is 10, so 8 for a low pressure is fine, that's 2 or 3 above and below, so we're good there. The delay for the alarm to sound, if we do go below 8 centimeters of pressure, is 20 seconds. That's reasonable. And an apnea time, if the patient were to stop breathing, is 20 seconds. So it would alarm for that. When I'm setting minute ventilation alarms, I'm going to look and see what my patient's actually doing. And this patient's breathing, like, again, anywhere from 600 to 900. So low minute ventilation with a minimum rate of, what do we set? We can go back to parameters and see here. So we set a rate of 12. So if we multiply 12 by 700, that'll give us a low minute ventilation for where the patient currently is doing. And then we can also look at the minute ventilation on the display screen. So if this person is doing anywhere from 10 to 13 liters, I would want to set my low minute ventilation closer to the 10 mark, so maybe about 8, because we see a 9 here. So they slow down, they speed up. So a couple liters above and below would be reasonable. High respiratory rate of 30-35 is acceptable when on non-invasive ventilation. And a low respiratory rate, if they're breathing fast, so if they're breathing in the 20s, I would set that closer to where they normally are. I wouldn't set it below a normal respiratory rate. So if they're breathing 20, I would set it at 14, because they may synchronize and rest with the machine more. So that's our alarm parameters. Those have been set, and then we can just go into monitoring or watching the screen, or parameters, which gives us a little bit more information down here. So that's our initial setup, our settings. Now we're going to go to titrating the machine with blood gases.